Go.
Hi, I'm Michelle Braccioforte from Chicago Prostate Center in Westmont, Illinois. I'm here with Jeff, one of our patients who underwent seed implant therapy here a couple years ago, and he's going to tell us about his experience.
Sure. My name is Jeff. I'm currently 57 years old. I was diagnosed with prostate cancer 2 years ago at the age of 55. I found out I had prostate cancer through the diligence of my primary care physician, who had been monitoring my PSA over the course of a few years. The PSA had gradually gone up and gotten to a point where she decided it was time to have a biopsy. I went in and had a 12-core biopsy and actually found out that I had a fair amount of cancer. 8 of the 12 cores came back positive for cancer. I was diagnosed as a G7. Getting that kind of news is never great. You go through a lot of different emotions and a lot of different stages. You know, you're scared, you're angry, you're confused, you don't know what to do. Once I got past all that, I decided that I needed to learn as much as I could about the disease first, and then about what the different treatment options might be out there. And one of the things that I found very quickly was that in terms of the best chance of cure as well as the best chance of maintaining quality of life, LDR brachytherapy is hands down the best treatment for someone with my intermediate stage of prostate cancer. Once I decided on LDR brachytherapy, the next thing I decided to do was I had made a decision early on that no matter where in the world I had to go to be treated, that I wanted to be treated by the best. Cancer is nothing to take lightly. My quality of life is nothing to take lightly. So I did my research. I met with a number of medical professionals, either over the phone or face-to-face, and ended up finding the Chicago Prostate Cancer Center in Westmont, Illinois, and came down for my initial consultation with Dr. Moran. And
yeah, you clearly did extensive research. You took your time. You explored all your treatment options, and once you decided on your option, you explored the physicians.
Yeah, you know, again, when you hear you're told you have cancer, and the first thing that most people are going to say is, "Oh my God, I have cancer, get it out." And you know that can be a big mistake. Prostate cancer, fortunately, is normally a very slow-growing cancer, and you have time. You have time to be able to understand the disease as well as a different treatment option available. And I would encourage anyone that finds himself in the same position to do what I did. You know, take your time. I took a few months to do my research. I would say I was compulsed with it, but looking back, it was absolutely the best thing to do, because had I not done that, I wouldn't have known about LDR brachytherapy or the Chicago Prostate Cancer Center. So that all worked out.
Well, you made a great decision by finding Dr. Brian Moran here at Chicago Prostate, who's the world's expert in seed implant therapy.
I did. And you know, now looking back 2 years later, I'm actually here today for my 2-year follow-up, and I can tell you that I knocked it out of the park again with a PSA. My PSA is now 0.13, which is phenomenal.
Excellent.
I'm obviously doing great from a physical standpoint. I never really did have any symptoms prior to diagnosis or afterwards, and my quality of life has not suffered one iota. I continue to do whatever I want to do physically. I don't have any issue with continency, ED, none of that.
Wonderful.
So yeah, it's been going absolutely great, and now it's just looking forward. There's no looking back.
That's right. Well, with the seed implant, it's one time, it's outpatient, there's no incisions, and you can really resume your normal activities right away. And it sounds like you went out for lunch or for dinner that same day. And
you know, when they say it's non-invasive, it really is. I had my implants done in the afternoon on a Friday. And immediately afterwards, we went next door to Papito's restaurant, which is a great seafood restaurant, by the way, and we had dinner, you know, 4 hours after my implants. After that, I went home and kind of took it easy for the weekend, and Monday morning went back to work, and again, I just have not looked back. No need to.
Great. And for you, Jeff, as well as, you know, most men, quality of life is really very important. So not only do people want their cure, you know, to be excellent, but quality of life issues. They want to maintain their urinary function, rectal function, sexual function, and just be able to do all the things that they were doing prior to this diagnosis.
Yeah, absolutely. You know, when you hear you have cancer, yeah, you want to cure the cancer, and most men will tell you, and I was the same vein. There's priorities. Cure the cancer, certainly. Maintain continency, and then maintain sexual function. And typically they're said 1, 2, 3. And for me, I'll be very honest with you and say 2 and 3 were very close to 1. I really was not willing, at my relatively young age and good physical condition, I was not ready to give up my quality of life. And fortunately, again, with LDR brachytherapy, because of the nature of the science behind the seed implants, you are able to maintain those functions. And again, 2 years later, PSA of 0.13 and no issues.
And you're very active. You have excellent hobbies, outdoors.
Yeah, I am, and that was a big part of it, Michelle. That's why I didn't want to give that up. I do a lot of backpacking. I do a lot of hunting and fishing, just generally out in the outdoors. I had shared a story with Dr. Moran not long after my implants where I took my son on a backpacking trip to a wilderness area where we hiked into a remote spot, 6 miles in, carrying a 50-pound pack, and he had to keep up with me. So, yeah, it's great. It really is. It's an amazing technology.
Well, we're so glad to hear how well you're doing, and thank you so much, Jeff.
You're welcome. Thank you, guys.